Okay. We finished Dinacharya and Trayapastambas. Ahara, Nidra and Brahmacharya along with Dinacharya. So till now we finished in Swasta. Today we'll start with Rutucharya. Okay. So here we will expect many questions in Rutu classification and classification of Rutus according to Sanskrita. Okay. And classification of Kala also. So during Padartha Vijnana we explained classification of Kala. So 15 Nimesha is equal to 1 Kasta, 30 Kasta is equal to 1 Kala. Okay. So 20 Kala plus 3 Kasta is equal to 1 Muhurta. Okay. This classification, you may know about it. So 30 Muhurta is equal to 1 Ahorata. Okay. 1 Muhurta is 48 minutes. So 30 Muhurta is equal to 1 Ahorata. So usually 24 hours is equal to 1 day. Okay. Like that. So 30 Muhurta is equal to 1 Ahorata, 1 day. So according to English time, 24 hours. So according to our classical Sanskrita time, it is 30 Muhurta is equal to 1 dina. 1 Ahoratra is 1 dina. Okay. So 15 Ahoratra is equal to 1 Paksha. Krishna Paksha and Shukla Paksha. Okay. So 2 Paksha is equal to 1 Masa. So 1 Paksha is equal to 15 days and 2 Paksha is equal to 1 month. 2 months is equal to 1 Rutu. 6 Ritu is equal to 1 Ayana. Okay. So 2 Ayanas is equal to 1 Samvatsara. So Uttarayana and Dakshinayana. So Uttarayana and Dakshinayana together, we can call it as 1 Samvatsara. So 5 Samvatsara is equal to 1 Yuga. 5 years is equal to 1 Yuga. So this is the time classification. Here in PGET, so Tapa Tapasya is which month? Like that the question will be asked. Tapa Tapasya is which month? Madhu Madhava is which month? So this is a Sanskrit classification of Rutu. Tapa Tapasya is Shashira. Madhu Madhava is Vasanta. Shuchi Shukra is Grishma. Okay. Nabo Navasya. So wherever you see only the clouds is Varsha. Nabo Navasya is Varsha. Irsha and Madhava, it is Sharat. Yamanta Sahasrasya. Okay, this is a Sanskrit classification of Rutu. Just go with it once, Sanskrit classification. And even we have one more Rutu classification according to Sanskrit. Chaitra, Vaishakha, Jyeshta, Ashada. So that one classification is there. So usually both the things will be asked. In Charaka Siddhisthana, we have Tapa Tapasya, Madhu Madhava, Nabanabasya is there. So Isha and Uruja. So just go with the Sanskrit classification, two types. One is the classical classification according to Charaka, and one more according to Sushruta. Both the classification you go through it, and then according to Rutu, Dosha Prakopa. Okay, so Dosha and Rutu. So in south we have Varsha, in north Acharya Sushrutam we call it as Pravrut. Okay, so Pravrut classification, Pravrut Rutu classification is there for North Indians. So South Indians we have Varsha Rutu. Little difference is there with Pravrut Rutu and Varsha Rutu. Pravrut classification is according to Acharya Sushruta. So Namge usually in south we will start early monsoon. So in the month of July, example in Karnataka, we will witness monsoon in the month of July. Sorry, June. So end of the May and the first week of June we started with monsoon. 1 month late in North India it will start. So July and after 15 days of July month. So they may witness monsoon. Okay, the rainy season. So in that classification they call it as Pravrut. Okay. So in Vata Prakopa also, so in south usually Vata Prakopa will be there in Varsha Rutu, in north Vata Prakopa will be there in Pravrut Rutu. Instead of Varsha, they call it as Pravrut, and but classification is 1 month delay. So North classification is 1 month delay. Okay. So usually Sheshira is 14th of January to 14th of March in South, or 15th of January to 15th of March. But in North, it will start from February 15th to April 15th. That is Sheshira. Okay, Sheshira Yamanta will share the same features. Okay, so 1 month delay. North, like that, Pravrut also there will be 1 month delay. Okay, that is a classification between South Rutus and North Rutus only because of climatical changes. Okay, if you compare with English Rutu, that is 1 month delayed, South and North. So even you may observe about in CBSE schools, so they will also give holidays based on this only. So in Maharashtra, summer holidays will be in the month of May and June. In Karnataka, summer holidays will be in the month of April and May. Okay, in extreme cold regions like Uttaranchal, Delhi and all, they will change according to their local climatic condition. So in all status, the summer holidays are not same. Okay, it's based on their local climatic condition. So this classification was made. So in the early morning time, when we wake up in the early morning time, even a day can be compared with all 6 rutus. All 6 rutus will witness in single day. So especially early morning is just like a Vasanta. Cool breeze will be there. So early morning is Vasanta Rutu. Madhyana is Grishma. Aparana. Evening is Pravrut. Pravrut Rutu. So Ratrika Purabha. So early night is Varsha Rutu. So Ardharatri is Sharad Rutu. Ushakal, early morning is Hemanta Rutu. Okay, in a day we have classified all Rutus. Okay, so Vasanta, Grishma, Pravrut, Varsha, Sharad, Hemanta. Okay, so in a day we will witness all 6 Rutus. This is the kind of Sushruta. Charaka. This Rutu classification is according to Charaka, Dina. Dina can be compared with all the Rutus. And Sanchaya Prakop and Prashamana, this is very important chart. You should note down. Very easily you can remember this chart. So Vata Prakopa will be taken place in Varsha Rutu. So just remember in which Rutu, which dosha will get Prakopa. Before attaining Prakopa, there will be Sanchaya. After attaining Prakopa, there will be Prashamana. So Vata will get Prakopa in Varsha Rutu. So previous Rutu, it will having Sanchaya. So Vata will get Chaya in Grishma, Prakopa in Varsha, Prasara in Sharad. So you should remember in which month it will get Prakopa. So why I will tell you to remember the Prakopa Avastha means during that season we will advise for the Panchakarma. Okay. So in Varsha Rutu we will advise Basti because of Vata Prakopa. In Sharad Rutu we will advise Virechana because of Pitta Prakopa. Okay. In Vasanta Rutu, we will advise Vamana because of Kapha Prakopa. Okay. So based on Rutu, we will advise Panchakarma. So before it will go in for a Prakopa, before it is attaining a Prakopa, there will be Sanchaya. After Prakopa, there will be Prashamana. So remember Prakopa Avastha in Rutu. So easily will remember Sanchaya and as well as Prashamana. So this is important chart. So Tumba easy question bantu andre. So it's a dead easy question means they will ask this one. This chart is important. So usually if you don't know the basics, you cannot apply your knowledge. Basics must be stronger. They may not ask you about Sanchaya Prakopa of this one, but they asked about when we can go for a natural basti. It must be known to you. So because of naturally Vata Prakopa will be happening in the month of Varsha, in the Rutu of Varsha. We should go with basti, natural basti in the month of Varsha Rutu. The question may be twisted, but if you have a basic knowledge, you can able to answer. Okay. So types of dravya used in different seasons as per Vagbata. In Shita Varsha Rutu, so Madhura Amla Lavana rasa should be used. In case of Vasanta Rutu, Kadakta Kashaya rasas. Vasanta Ritu, Katatikta and Kashaya Rasa. In case of Grishma Ritu, Madhura Rasa, Sharat, Madhura Tikta Kashaya, Sharat and Vasanta, Ruksha Dravya, Grishma and Sharat, Shita Dravya. So just remember the predominant of rasas and their dravyas used in different rutus. Types of liquid used during different seasons. In case of Grishma, in the Grishma Ritu, we will go with cold water. So because of external heat, we will go with plenty of cold water. Shita Jala is Shrestha. So during Grishma Ritu. In Hemanta, we will use Sidhu and Arishta. So we will use Sidhu and Arishta in major quantity, and this is indicated. In Hemanta Ritu, what are the payas can be used is Sidhu and Arishta. So in Grishma Ritu, Shita Jala and Panakas. Shita Jala and Panakas, cold Shita Guna Panakas we can use. Hemanta Ritu, Sidhu and Arishtas. Vasantadalli only plain water will use in plenty. Sharad also we can go with the cold water in plenty. Pravrutalli Acharya advice to go for Mamsaras. Okay. So Pravrut is an intermittent Rutu between a summer and as well as rainy. Pravrut is intermittent. Summer and rainy intermittent Rutu. It will share both the thing. Season and rasa predominance. This is also very important. So just mark it up this chart. So which rasa is predominant in which Rutu? So just look at the cursor. So write down Rutu, Shashira, Vasanta, Grishma, Varshara, Demanta like this and start writing Ulta. First you write Madhura, then Amla and Lavana. So Madhura, Amla, Lavana like this. And here Katu, Tikta, Kashaya. Okay, so just observe the cursor. Madhura, Amla, Lavana, Katu, Tikta, Kashaya. Okay, so Madhura, Amla is in Varsharatu, Sharadratu, Lavana. So Shashiraದಲ್ಲಿ ತಿಕ್ತ, ವಸಂತದಲ್ಲಿ ಕಷಾಯ, ಗ್ರೀಷ್ಮದಲ್ಲಿ ಕಟು, ವರ್ಷದಲ್ಲಿ ಆಮ್ಲ, ಶರತ್ತಲ್ಲಿ ಲವಣ, ಹೇಮಂತದಲ್ಲಿ ಮಧುರ. ಎಕ್ಸಾಕ್ಟ್ಲಿ ಉಲ್ಟಾ ಇಲ್ಲ ಅದು. ಮಧುರ ಹೋಗಿ ಮತ್ತೆ ಮಿಡಲ್ ಅಲ್ಲಿ ಆಮ್ಲ ಬರುತ್ತೆ, ದೆನ್ ಲವಣ. ಕಟು, ದೆನ್ ತಿಕ್ತ, ಇನ್ ಮಿಡಲ್ ಕಷಾಯ. Okay, so just remember this chart, it's very important. And bala. So in which rutus will have a good bala, madhyama bala and uttama bala. So in the months of Grishma and Varsha we have alpha bala. Okay, so Vasanta and Sharat madhyama bala, Hemanta and Shashira uttama bala. Okay, Hemanta Rutucharya. So just go through the chart. I will share you the slide. All Rutucharyas. So you think about what is the condition in the external environment, one thing, and what are the changes will happen inside the body. Two things. Inside the body means dosha variation. Externally means climatic variation, along with which class should be where, and what are the foodstuffs to be taken, and what are the foods to be avoided. All those things, just concentrate on these things. So I will share you the slide. Rutu Aritaki is most important. So we can expect one question. Almost all exams you will get a Rutu Aritaki question. Last 10 years, more than 10 times you will get Rutu Aritaki. Okay. So Varsha Rutu, Aritaki is Patya, Aritaki is Sadapatya. We can take Aritaki in all the Rutus with suitable Anupana. Okay, in case of Varsha Rutu, so the Anupana is Madhu. So Grishma Rutu, Guda. ವರ್ಷಾಲ ಪಾದು ಶಿಶಿರ ಇಲ್ಲ ಶಿಶಿರ ವಸಂತ ಹೇಮಂತ 1 minute. This is ವಸಂತ. ವರ್ಷ ಆಗಿದೆ. ಫಸ್ಟ್ ಒನ್ is ವಸಂತ. This is ವಸಂತ ಋತು ಮಧು. ಗ್ರೀಷ್ಮ is ಗುಡ. ವರ್ಷ ಸೈಂಧವ ಲವಣ. ಶರದ್ ಋತು ಶರ್ಕರ. ಹೇಮಂತ ಋತು ಶುಂಠಿ. ಶಿಶಿರ ಋತು ಪಿಪ್ಪಲಿ. ವಸಂತ ಋತು ಮಧು. ಗ್ರೀಷ್ಮ ಋತು ಗುಡ. ವರ್ಷ ಋತು ಸೈಂಧವ ಲವಣ. ಶರತ್ ಋತು ಶರ್ಕರ. ಹೇಮಂತ ಋತು ಶುಂಠಿ. ಶಿಶಿರ ಋತು ಪಿಪ್ಪಲಿ. ವಸಂತ ಮಧು. ಗ್ರೀಷ್ಮ ಗುಡ. ವರ್ಷ ಸೈಂಧವ. ಶರತ್ ಶರ್ಕರ. ಹೇಮಂತ ಋತು ಶುಂಠಿ. ಶಿಶಿರ ಪಿಪ್ಪಲಿ. Shishira, Kala same. Okay, you just remember. So, Rutu Haritaki, usually in Vasanta Rutu, what you will feel? So, there is a flowering season. Vasanta is flowering season. In Mediterranean forest, just like, so we are living in Mediterranean forest. So, usually all trees will shed their leaves in Vasanta. So, trees will shedding their leaf before starting of a hot summer. ಈಗೆಲ್ಲ ಆಲ್ಮೋಸ್ಟ್ ನೋಡಿರ್ತೀರ ಲೀವ್ಸ್ ಎಲ್ಲ ಬೀಳ್ತಾ ಇರುತ್ತೆ, ಹೊಸ ಲೀವ್ಸ್ ಬರ್ತಾ ಇರುತ್ತೆ. So Yugadi, what we will celebrate? So during that time, completely a new leaves and as well as new flowers will be formed. So during Yugadi, so in the March end. So this Rutu is Vasanta Rutu. Vasanta Rutu nalli there is a fall of old leaves and there is a new growth of new leaves and as well as flowers. So ಅವಾಗ ನಿಮಗೆ maximum honey will be collected. So honey will be collected from the fluorescence. Flowers in the ತಗೊಳೋದು. Honeybee will collect honey from the flowers. Which is the flowering season? That is Vasanta Rutu. Vasanta Rutu Anupana is Madhu. Okay. So and for Kapha is going Prakopa during Vasanta Rutu. So it is the Shrestha Drava for Kapha Madhu. Kapha kuda Madhu and Vasanta Rutu kuda naturally Madhu will collect. So which is the Anupana for Haritaki in Vasanta Rutu? Madhu. Easily it is understood. So Grishma Rutu will addicted to Panakas. So because of hot summer, to rescue us from a hot summer, we will drink lot of Panakas. So without Jaggery, we cannot make Panaka. Just remember. So in Grishma Rutu, remember Panaka and remember Jaggery. Okay. So and in Varsha Rutu there will be a prakopa of Vata dosha. Shrestha dravya for Vata is Lavana. Madhura Amla Lavana. Out of that, Lavana is Shrestha. Okay. So in case of Varsha Rutu, Anupana is Saindava Lavana. In case of Sharat Rutu, Sharat is Pitta Prakopa Kala. So Sharkara will do Pitta Shavana. Guda will increase Pitta, but Sharkara will do Pitta Shavana. Mishri, Kalsakra ella ಹೇಳ್ತಾ ಇರ್ತೀವಿ, ತಂಪಾಗತ್ತೆ ಬಾಡಿ. You can take Kalsakra in that. So in Sharad Rutu, we can advise Haritaki with Sharkara. And apart from that, last two Rutus, Hemanta and Shishira, is cold Rutus. In Hemanta, we will advise Shunti as an Anupana. So in Shishira, Pippali as an Anupana. Shunti and Pippali. Shunti is in Hemanta Rutu, Shishira Rutu, Pippali. You will get confusion with Hemanta and Shishira. You just remember HS, Hemanta, Shunti, and SP, Shishira, Pipali. SPHS SP. Okay. So just remember. So Hemant Rutu, that is the Anupana is Shunti. Shishir Rutu Anupana is Pipali. There will be an 100% guaranteed you may get one question from Rutu Aditya. Don't forget, anytime you should remember Rutu. It's a basic FAQ. Okay. This is an basic FAQ. Next, Yamadamstakala, the last 8 days of Kartika Masa and first 8 days of Margashira Masa. Total 16 days constitute Yamadamstakala described by Acharya Sharanga. During that period, there will be a lot of Agni variation in the body. If you can't able to maintain proper Agni during that period, there will be severe Agni vitiation and that patient may going to die. That person may going to die. So it is the explanation given regarding Yamadamstakala. Okay. So Rutu Sandhi, Rutvar Antyadi Sapta. Rutu Adi and Antya 7 days is called as Rutu Sandhi. First 7 days of the new Rutu and the last 7 days of the old Rutu. It's called as Rutu Sandhi. So don't get confused with Rutu Sandhi and Yamadamstakala. Yamadamstakala is 16 days and Rutu Sandhi is 14 days. Yamadamstakala is 16 days, 8 days. Rutu Sandhi is 14 days. Okay. So Janapada Domsa, this explanation is the Charaka Samhita Charaka Vimanasthana, third chapter. So during Janodamsa, first thing to be vitiated is Vayu, then Jala, then Desha and Kala. So chronological order. Okay, first vitiation will be taken place with Vayu, then Jala, then Desha and then Kala. So the properties of Jala during the Rutus, Vasanta Rutu, the Jala will be Guru Abhishanda and Modara. And which is the Shrestha Jala? Mahendra Jala. Mahendra Jala means rainwater is Shrestha Jala. So just go through this chart. So this is about Rutucharya. In Rutucharya, you should remember Dosha Prakopa according to Rutus. Rutu Aritaki should be memorized. And apart from that, what are the foodstuffs should be taken, which refers predominant in particular Rutu. And clothing. Clothing also very important. And internal environment status and external environment status. These points should be remembered in case of Rutucharya. Next, we will move on to yoga. Rutu and Rashi relation explained in Sharangadhara Samhita. So this is also one of the important effects. Rutu Rashi relation and to Sharangadhara. We just write down Mesha and Rushabha, Grishma Rutu. Mesha and Rushabha, Grishma Rutu. Mesha and Rushabha, Grishma Rutu. Mithuna and Karka, Pravrut Rutu. Mithuna and Karka, Pravrut Rutu. Simha and Kanya, Varsha Rutu. Simha and Kanya, Varsha Rutu. Tula and Rushika, Sharad Rutu. Tula and Rushika, Sharad Rutu. Danu and Makara, Hemant Rutu. Danu and Makara, Hemant Rutu. Kumbha and Meena, Vasant Rutu. Kumbha and Meena, Vasant Rutu. So just check it up. Those who are born in between Vasanta Rutu, definitely they were having this Rashis. Okay. This Rashis is based on the time of the year. Okay. So Mesha and Rushabha, Grishma Rutu, Mithuna and Karka, Pravrut Rutu, Simha and Kanya, Varsha Rutu, Tula and Rushika, Sharad Rutu, Danu and Makara, Hemant Rutu, Kumbha and Meena, Vasant Rutu. Okay. So which is the first Rutu explained in particular Samhitas? In Charaka Samhita, first Rutu was Hemanta. Sushruta Samhita is Shashira Rutu, Magha Masa. In Charaka Samhita, first Rutu explained is Hemanta. So Vishnu Samhita, first Rutu explained is Magha Masa, Shishir Rutu. In Vaidika Kala, it is Sharad Rutu, first month to be explained. According to Jyotish Shastra, Vaishaka Masa. So usually in Kannada Rutus now, Kaltidu Chaitra, Vaishaka, Jeshta, Ashada. So ಆ ರೀತಿ. We start with Chaitra. And we have a questions regarding Upavasa. So Upavasa will comes under Langana. So you know about Dashavida Langana. So Vamana Virechana, Shiro Virechana, Niruha Basti, Pipasa, Vayu Sevana, Dupa Sevana, Pachana, Dravya Prayoga, and Upavasa. So Upavasa is one among the Dashavida Langana. So it's one of the Dashavida Langana. So Langana is having two types, Shodhana and Shamana. So it is Shamana. ಯಾವುದು ಉಪವಾಸ is one of the shamana, one among the 10 types of langanas. ಯತ್ಕಿಂಚಿತ್ ಲಾಘವಕರಂ ದೇಹ ಲಘುತ್ವಂ ಸ್ಮೃತಂ. ಯತ್ಕಿಂಚಿತ್ ಲಾಘವಕರಂ ದೇಹ ಲಘುತ್ವಂ ಸ್ಮೃತಂ. It is the definition of upavasa according to Charaka Samhita 22nd chapter 9th shloka. Sushruta upavasa is explained in 46th chapter, Ashtanga Sangraha 24th chapter. So what is the benefit of upvasa? So body will get lighter and lagutva can be achieved by going with upvasa. So usually when speaking with the diabetes, we will advise them to take a strict diet of low calorie liquid diet. So usual calorie requirement for every person is around some 2200 to 3500 calories. So sedentary lifestyle 2300 calories. So hard working 2800 to 3500 calories. Pregnant woman 3200 calories. This is the calorie requirement per day. So usually each carbohydrate will yield you, each gram of carbohydrate will yield you 4 kilocalories of energy. Each protein and fat is also same. Carb, protein and fat, each kilogram will produce 4 kilocalories of energy. Okay. So if you eat around some 500 grams of food in a day, that will yield you 2000 kilocalories of energy. Around some 600 grams and 2400 kilocalories of energy. Daily intake, overall breakfast, lunch, dinner, along with fruits, vegetables, everything. So we will take around 600 grams in a day. If we eat more, what happens? If we eat more than 600 calories in a day, so it will be deposited in the form of fat, so inside the body. That glucose, excess of glucose will be converted into fat. So what happens in case of diabetes? So increased fat, increased maida in the body, that will obstruct the functions of insulin. So what is the main function of insulin? Transport of glucose from blood to muscle. So more amount of fat accumulated inside the muscle, that will obstruct the function of insulin. So insulin cannot able to transport glucose to the muscle, and it will open the door in the muscle cells for glucose. So that reaction will also not take place if the body will accumulate more amount of fat. Why it will accumulate? We won't give rest to the body. You won't give rest to pancreas, and you won't give rest to liver. If you take very less amount of food, So total food you should take only 200 grams in a day. So that should yield 800 kilocalories of energy. If your daily requirement will be cut off from 2500 to 1000 kilocalories, automatically body fat will start burning. Your weight management can be achieved if you cover your total food only within 1000 kilocalories. So how to achieve it? So by consuming excess of vegetables. Usually vegetables doesn't contain more amount of carbohydrates or more amount of fat or more amount of protein. Okay? So it is a source of fibers, vitamin and micronutrition. So and your stomach will be fulfilled and there will be very less accumulation of carbohydrates or protein in the body. Okay, so that will gives you a reverse mechanism, reverse action, that is breakdown of fats inside the food. Okay, so less calories and very less amount of carbohydrates, very less amount of protein, very less amount of fat. So that we in that way we can achieve you the weight loss and as well as to maintain diabetes also. So we can reverse diabetes by giving rest to so liver and as well as pancreas. If you're giving rest to liver and pancreas, there will be rejuvenation will happen. So usually if you are doing classes regularly more than 12 hours a day, you won't get time to read. If you give rest for you, you will read and you will recall and you will remember, you finally will reproduce. So it is the same way if you feed the body continuously, body doesn't have time to rejuvenate itself. Body doesn't have time to cleanse itself. Okay, so ನಿಮ್ಗೆ ಏನಕ್ಕೂ ಟೈಮೇ ಸಿಗ್ತಿಲ್ಲ ಅಂತಂದ್ರೆ ನೀವು ರೆಸ್ಟ್ ಮಾಡಕ್ ರಿಲ್ಯಾಕ್ಸ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗಲ್ಲ. So if body start resting and relaxing and then it will start up with rejuvenation. So automatically insulin resistance will decreases when you go with upavasa. Upavasana will not advise complete upavasa here, it is langana. Lagu bhojana should be advised. And ಲಘು ಭೋಜನ ಅಂತ ಅಂದ್ರೆ ಗುರುತ ಇರಬೇಕು, ದ್ರವ್ಯತ ಗುರು ಇರಬೇಕು, ಗುಣತಃ ಲಘು ಇರಬೇಕು. Otherwise our thirst and appetite will not be fulfilled. The dravya what you will going to eat is dravyatah guru and gunatah and karmatah laghu. Okay, the easily thing is vegetables. And one more advantage of consumption of vegetables is almost all vegetables are alkaline in nature. So alkalinity is very important in the blood. If you eat a meat or non-vegetarian food or a high amount of protein with egg and other things, it's an acidic. So blood ಅಲ್ಲಿ acid levels ಜಾಸ್ತಿ ಆಗುತ್ತೆ. Okay, so it is not good for internal environment. If you eat vegetables, the alkalinity will increase in the blood. So nowadays it's a very passionate thing. Everywhere they will consume alkaline water. Alkaline water is the water that will keep the blood in alkaline pH so that body will heal itself. It will repair any of the diseases by itself. Even for the cancer and autoimmune diseases, so they are advising only alkaline water. Keep body in alkaline, basic pH. Don't keep body in acid pH. Blood is slightly acidic, 7.2 to 7.8, slightly acidic. It's not basic or it's not completely basic, it's not completely acidic, slightly alkaline. Blood is slightly alkaline, it's not acidic, it's slightly alkaline. So if you feed the body with alkalinity, so definitely body will heal, it will heal any of the diseases. Okay, so rest kotra things will be, we can cure any disease. Body has the capacity to cure any disease by itself. Even the fracture will happen automatically within 2 months, it will heal. What we have to do is give rest and reduction. Okay, so anything happen in the body, it will heal automatically, but you have to create a suitable environment for healing. ಗಾಯ ಆಯ್ತು ಅಂದ್ಬಿಟ್ಟು ಅದಕ್ಕೆ ನೀವು ಹೆಂಗೆ ಆಂಟಿಸೆಪ್ಟಿಕ್ ಹಾಕಿ ಪ್ರಿಸರ್ವ್ ಮಾಡಿ ಇನ್ಫೆಕ್ಷನ್ ಆಗದಂಗೆ how we will prevent? Not like that only. If anything happens in the body, it may be a diabetes, it may be an autoimmune disease, it may be a thyroid, so we should give a suitable environment to the body to heal itself. Okay, so body will repair itself. The body mechanism is like that only. Okay, so just think about endocrine system. So, you know about positive feedback mechanism and negative feedback mechanism. If the hormone levels increases, then it will go sensor to the sense will be go to the brain, and brain will stop the production of hormone. So, out of that, we can consider brain as the biggest endocrine gland. It will control all the endocrine glands. Then we can call brain as a biggest endocrine gland. You know, so it will control all the hormone secretion and as well as its overproduction or underproduction. It will be controlled by brain. Okay, so if you give rest to the body, and brain will also relaxes. So what happens during Gomana or Virechana or during Snehapana? So during Snehapana, we will advise you very less amount of food. So during Snehapana, what is our intention is we should not give the food into the body that will go into influence on insulin secretion. Some of the foodstuffs recorded in research, this will not going to initiate insulin secretion. Example is cucumber, sautekai. After eating a cucumber, cucumber doesn't contains carbohydrate levels, so that it won't initiate the insulin secretion. Okay, and tomato also won't uh, initiate insulin secretion, non-insulin secreting foods. Out of that, these two foods will stand first. If they have an appetite, let them take these two foods. So the pancreas will be under rest only. Okay, during Snapana also, whatever the food stuff we will advise you is very less amount of ganji or light, liquid and low calorie food. So that the pancreas will get rest. By taking excess of sneha, liver will work harder to digest the sneha. So 30 ml of vrutta if you take, liver has to produce 60 ml of bile juice for digestion of vrutta. So in this level, so liver is working hard to digest vrutta, and by itself it will lose its fat, and as well as pancreas will take a rest. So in those combination, kidney will also get rejuvenated. So during Snehapana, Rukka is made up of Rakta Medo Prasadat Rukka. Rukka is made up of Rakta and as well as Medas. If you give Snehapana, Rukka will also get rejuvenates. Kidneys also will get rejuvenates. On a single procedure, Virechana or Vamana or any of these Sneha conditions, so we can able to rejuvenate kidney, liver and pancreas together. And at the same time, we will give rest to the intestine also. During Snehapana period, we won't take much amount of food so that whole body will be under rest. So rest siktantane, there is a chance of rejuvenation, correction by itself. So many of the patients after giving Virechana, their glucose will be under control without any medication, just Virechana is enough. Proper Virechana should be done, proper Shudana should be done. Okay, so this is the role of Panchakarma in repairing disease, in repairing an autoimmune diseases. Okay. So out of that, Upavasa is an excellent one. So we can adapt Upavasa. So periodical Upavasa is good to the body for proper rejuvenation. So usually Sankashti, Ekadashi, Sankashti timely, we will go regular rituals on Upavasa. It's good. At least once in a week, you should go for Upavasa. It's very good for rejuvenation. So if you ask some yogis or some Swamijis, so how to keep healthy, they are telling cut down your one meal. Usually we will take 3 meals. So in that heavy calories we will eat. So just cut down your one meal. Okay, to better to take only 2 meals. So then the total cut down was one meal. In 7 days you will cut down 7 meals. In a month you will cut down 28 meals. So how much quantity of food you have reduced? Okay, and the meanwhile, in between the diet, you can take non-insulin producing fruits and vegetables. The cucumber and tomato you can take. Green tea, black coffee you can take. And buttermilk you can take. Buttermilk will not at all contain any amount of carbohydrates. Skimmed buttermilk that you can take. Okay, so water you can take any amount, any quantity of water. So it's called as intermittent fasting. 2 meals in a day is called as intermittent fasting. So 1 hour will be the window period. Early in the morning, 9 to 10 o'clock, you can take 1 hour, any food stuff, whatever you want. After that, till after 8 hours only, you have to go for meal. Till evening, till 4 to 5 p.m., should not go to any meal. So after taking a second meal, you will be in the fasting for another 16 hours till tomorrow morning. It's called as intermittent fasting. During that time, you will be given complete rest to your body system. Continuous eating, eating, eating. So you won't give rest to the body. In intermittent fasting, you are giving a rest to the body. The whole body system will rejuvenate. So low calorie split diet are with good amount of food with in intermittent fasting. These are all the two diet plans that will be given to any of the diabetic patients. Either they should go for intermittent or else they should go for split diet, low calorie, liquid food. You just adopt these two techniques. It's also part of upvasa. Intermittent fasting only 8 hours between the two meals upvasa and 16 hours between the two meals. Evening and morning meals 16 hours. Right? So low calorie diet only you will cut down your food from 2500 to 1000 calories. And how to make it other things we will discuss later. So this is the importance of upvasa. Dharani Vega, Adharani Vega, you can make a chart of it. And Rasa Utpatti. So one question was asked in 2016 and 17. So when Akasha Jala falls on Shweta Bhumi, what will be the rasa of the Jala? So like that, we have a 6 references like that. So write down. If Akasha Jala falls on Shweta Bhumi, that Bhumi attains Kashaya Rasa. Shweta Bhumi, just write down Kashaya Rasa. Akasha Jala falls on Shweta Bhumi, so it will attain Kashaya Rasa. Akasha Jala falls on Pandura Varna Bhumi, Tikta Rasa. Pandavarna Bhumi, Tikta Rasa. Pandavarna Bhumi, Tikta Rasa. Kapila Varna Bhumi, it will attains Kshara. Kapila Varna Bhumi attains Kshara. Ushara Bhumi, Lavana Rasa. Ushara Bhumi, Lavana Rasa. Ushara Bhumi, Lavana Rasa. If Akashila falls on Parvata, so it will attain Katu Rasa. If falls on Parvata Pradesha, that will attain Katu Rasa. If Akasha Bhumi falls on Krishna Mrittika, black salt, sorry, black soil, Krishna Mrittika, black soil, it will attain Madhura Rasa. So you just check about sugarcane and sugarcane fields. Many a times it will be black color only. Black color soil is good to grow sugarcane because when Akashila falls on this black color, it will attain Madhurasa. Madhurasa Bhumi is Shrestha for growing sugarcanes. Okay, so this is the reference. Just remember this chart. We may expect one question. The Akash Bhumi falls on so and so color mud, it will attain so and so rasas. So ಕೆಲವೊಂದು ಋತುದು ಶ್ಲೋಕಗಳು ನೆನ್ಪಿಟ್ಕೊಂಡ್ರೆ ಬೆಟರು. ಸೊ ಲಾಸ್ಟ್ ಟೈಮ್ ಕೇಳಿದ್ದು ಬಲಿ ನಾಂ ಬಲಿ, ವಿಚ್ ಋತು? ಶೀತೆ ಶೀತಾರಲ ಸಂಸ್ಪರ್ಶೆ ಸಮೃದ್ಧೆ ಬಲಿನಾಂ ಬಲಿ. ಶೀತೆ ಶೀತಾರಲ ಸ್ಪರ್ಶಂ ಸಮೃದ್ಧೌ ಬಲಿನಾಂ ಬಲಿ. ಚರಕ ಸೂತ್ರ. Shite Shitanina Samsparshe Samruddham Balinam Bali is Hemantarutu. Hemantarutu is called as Tushara Kala. Hemantarutu, Tushara Kala. Shite Shitanina Samsparshe Samruddhe Balinam Bali. Balinam Bali. Hemantarutu, Tushara Kala. Mute ಮಾಡಿ ಯಾರ್ದು ಅನ್ಬಿಟ್ಟ वसन्ते अत्र मदनोत्सवः मदनोत्सव इति वसन्तः मदनोत्साह मदनोत्साह मदनोत्सवः इति वसन्तः मदनोत्साह मदनोत्सव इति वसन्तः Sarani Adharani, I can just go through it. So Samudra Jala Guna, it is Visra, Ridosha Karaka, Lavana Rasa Yukta. Samudra Jala is Visra, Tridosha Karaka, Lavana Jala Yukta. Ushnodaka, the boiled water is Mutrashaya Shodaka and Lagu. Ushnodaka is Mutrashaya Shodaka and Lagu. So Jangala Deshada Jala is, it is good to drink. Prashamsita. Jangala Deshada Jala is Prashamsaniya. Anupadesha Jala is Nindita. Sadharana Desha Jala is Shrestha. And it is Avidai. Shitala and Lagu. Sadharana Desha Jala is good to drink. It is Shrestha, Avidai, Shitala and Lagu. Jangala Desha Prashamsaniya. Anupadesha Nindita. Sadharana Desha Shrestha, Avidai, Shitala and Lagu. According to the modern also, the well waters is good. Bavi Jala Delva, the water we will extract from the well is good for drinking compared to the water present in the surface. Okay. Nowadays we are using a tube wells. Bavi system okay. So now we are using a tube wells. It's good for health. You know about soft water and hard water. What is the reason for hardness of the water? How will you assist whether the water is soft or hard? So if you want to give the foam with a detergent, it is hard water. If it is gives a proper foam with a detergent, it is soft water. So what is the causes for hardness of water? For temporary hardness, calcium and magnesium carbonates is it in the water. For temporary hardness, calcium and magnesium carbonate present in the water. calcium and magnesium carbonate present in the water. So it is for temporary hardness. So temporary hardness, calcium and magnesium carbonate present in water. Permanent hardness, along with calcium and magnesium chloride, there will be sulfate, calcium and magnesium sulfate, and magnesium nitrate is also present. Waterborne diseases we can write down. Waterborne bacterial infections. Waterborne bacterial infections. In waterborne infections, first heading is waterborne bacterial infections. Diarrhea, dysentery, typhoid, cholera. Diarrhea, dysentery, typhoid, and cholera are the main diseases which will spread through water. Waterborne bacterial infection. Waterborne viral infections are infectious hepatitis and poliomyelitis. Poliomyelitis is also a waterborne viral infection. So 2 years back, the water in Hyderabad was tested, and it contains a poliovirus. Still, poliovirus is there in our country, but we are all vaccinated. That's why the incidence rate is very less. The infection rate becomes lesser because we are vaccinated. And still in other countries like Pakistan, Afghanistan, Bangla, so their polio incidences are still present. Though we are vaccinating ourselves, and in India, almost all the polio infection reduced to 1%, not from 99% to it has been reduced to 1%. Very, very less incidence of polio we are witnessing nowadays because of proper vaccination. So we'll going to achieve it 100% soon. Why still we are continuing the polio vaccination is because our other countries, border countries, still today they are not achieved complete polio vaccination and they are not get rid of polio. So that's why still we need to go with vaccinations. There is a chance of cross infection from other countries. So viral waterborne infections are infectious hepatitis and poliomyelitis. Protozoal infections. Protozoal waterborne infections are amoebiasis and giardiasis. Amoebiasis and giardiasis. So waterborne elemental infections. Waterborne elemental infections. Roundworm, threadworm, whipworm. Waterborne leptospiral infection is leptospirosis. So leptospirosis is also mimics like that of osteoarthritis. Sorry, rheumatoid arthritis. There will be huge swelling in the joint along with fever and pain. Leptospirosis, and it will infect our liver also. So usually in viral hepatitis, 1 or 2 days there will be acute fever, then there will be no fever. But in case of leptospirosis, continuous fever will be there along with increased bilirubin and joint pain. So these are the classical symptoms of leptospirosis. Usually, leptospirosis is very common microorganism present in animals. Many a times we will contact these microbial things from animals, especially buffalo and cow. Leptospira. Okay. So now it is 5:40. Just to 2 minutes break. We'll continue another half an hour class. Okay. So water purification. So for mechanical method, we have two things: slow sand filtration and rapid sand filtration. In water purification, in mechanical method, we have two: slow sand filtration and rapid sand filtration. So next level question is, they will ask you about how many steps involved in slow sand filtration and how many steps involved in rapid sand filtration. There are three steps involved in slow sand filtration. Three steps involved in slow sand filtration. So one first step is storage, second step is sedimentation, third step is filtration. Storage, sedimentation and filtration. Storage, sedimentation and filtration. Slow sand filtration, three methods: storage, sedimentation and filtration. So same like in rapid sand filtration, it involves five methods. Okay, so rapid sand filtration involves five methods. First one is coagulation. First step is coagulation. Second step is flocculation. Third step is sedimentation. Fourth step is filtration. Fifth step is chlorination. I will repeat. Rapid sand filtration involves five steps: coagulation, flocculation, sedimentation, filtration, and chlorination. In some books, they are given rapid sand filtration involves only four methods. So there what happens, the coagulation and flocculation, they call it as one method only. ಅದು ಕೂಡ opinion ಇದೆ, but in park and park, we should go with park and park. Preventive and social medicine, there they are given very clearly, it involves five methods. So flocculation and coagulation are separate methods. So first is coagulation, second is flocculation, third is sedimentation, fourth is filtration, and fifth is chlorination. So what is the height of sand bed in rapid sand filtration? 1.2 meters. 1.2 meters. The height of sand bed is 1.2 meters. 1.2 meters. So what is this chlorination method? Usually in cities like Bangalore, we will get a filtered water only. So you just smell the water, we will get a chlorine smell. So what is the amount of chlorine should be used for purification is, usually for chlorination they will use a bleaching powder. That is a 2 grams of bleaching powder will be used for 100 gallons of water. Okay, 2 grams of bleaching powder used for 100 gallons of water. ಇವಾಗೆಲ್ಲ ಸ್ವಲ್ಪ ಮೆಥಡ್ಸ್ ಎಲ್ಲ ಚೇಂಜ್ ಆಗಿದೆ, ಓಝನೈಸೇಷನ್ ಎಲ್ಲ ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಅಲ್ಟ್ರಾವೈಲೆಟ್ ರೈಸ್ ಯೂಸ್ ಮಾಡಬಹುದು, ಅಂಡ್ ಕ್ಲೋರಿನ್ ಗ್ಯಾಸಸ್ ಕೂಡ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಸೊ ಡಿಪೆಂಡ್ಸ್. ಸೊ ಒಂದೊಂದು ಸಿಟಿನಲ್ಲಿ ಒಂಥರ ಮೆಥಡ್ ಇರುತ್ತೆ. ಸೊ chlorination definitely the step to make the water disinfectant. Okay, so filtration ಅಲ್ಲೆಲ್ಲ ನಿಮಗೆ ಬೇರೆದು ಸ್ಯಾಂಡ್ ಪಾರ್ಟಿಕಲ್ಸ್ ಅದೆಲ್ಲ ಹೊಂಟೋಗ್ಬಿಟ್ಟಿರುತ್ತೆ, mud particles and other things will go, but in chlorination only we will get rid of the microbes. Okay. Usually water contains arsenic, cadmium, cyanide, lead, mercury, selenium, iron, manganese, zinc, copper, calcium, sulfide, chloride, and phenolic substances. So our water may contain these substances with the WHO limits. Almost all these are 0.015, 0.01, 0.04, like that only. So just remember, so many minerals will be present in drinking water. So the levels is according to the WHO. What is the pH of drinking water? Normal drinking water pH according to WHO. So 7 to 8.5. the drinking water pH may go from 7 to 8.5. Till then we can use the water 7 to 8.5. The pH of drinking water is 7 to 8.5. Upper limit of tolerance of noise general, the tolerance of noise in general, upper limit 85 decibels. 85 decibels. Permanent loss of hearing will happen if you continuously expose your ear at 100 decibels, then there will be a continuous hearing loss. Okay, so the range is up to 85 decibels. We can hear more than 85 decibels. So damage start agate. If we expose to 100 decibels continuously, that will leads to continuous hearing loss, permanent hearing loss. Permanent hearing loss will be there if you expose more than 100 decibels continuously. Okay. ತುಂಬಾ ಬೇರೆ ಬೇರೆ ಪಾಯಿಂಟ್ಸ್ ಇದೆ, ನಾಟ್ ನೆಸೆಸರಿ. You know about the vaccines. So vaccine will be kept in cold boxes. So usually during COVID vaccination, there's a mass vaccination all over India. During that time, we have seen in TVs and all how the vaccine will be prevented in cold chains. The cold box, we can prevent a vaccine up to 1 week. So usually nurses will carry the cold box. You remember the boxes, cold boxes. In that we can keep the vaccine for 1 week. The transport boxes will we can keep it for 3 days. Cold box only 1 week without changing rice and all we can keep to 1 week. Then transport boxes only 3 days we can keep. And flask, cold flask it is also an alternative for substitute. It's a substitute for carrying of vaccines. Ice packs will we can use, or else we can keep it in refrigerators. So in freezer compartment, temperature should be more than 4 degrees Celsius. ತುಂಬಾ ಕಮ್ಮಿ ಇತ್ತಂತಂದ್ರೆ ಕೂಡ ಆಗಲ್ಲ. What are the vaccine we should keep at the temperature of 4 degrees Celsius is oral polio vaccines, measles, MMR, rabies, BCG. Sorry, oral OPV, measles, MMR, and rabies vaccines are highly heat layables. ತೊಂದರೆ ಇಲ್ಲ, ಅವು heat layables ಇರುತ್ತೆ. And BCG vaccine also we can store in the same temperature. 0 degree ಬೇಕಾಗಿಲ್ಲ. So freezer box, complete freezer box ಬೇಕಾಗಿಲ್ಲ. We can store this vaccine at 4 degree Celsius. So if we can able to store OPV vaccine in minus 20 degree, okay, so we can extend the life of the vaccine for 3 months to 1 year. So usually in mass storage. So OPV vaccine manufacturer, we cannot use it for a 1 year, and we need to store it within minus 20 degrees Celsius. Okay, so we can utilize the vaccine for 3 months to 1 year. So store in that temperature. DPT typhoidella we can freeze from 4 to 8 degree Celsius. So in PFC ice lined refrigerators there only will store. And some general points. Schick test will be done for the diagnosis of diphtheria antigen. Schick test, SHICK. Schick test will be advised for diagnosis of diphtheria. You know about PCR test, polymerase chain reaction test. In COVID also, we will address reverse PCR. Reverse PCR is a gold standard test in diagnosis of HCV and RNA viruses. Okay, any HCV and RNA viruses will use PCR test. Polymerase chain reaction test. Same test is gold standard in case of tuberculosis, HIV infection, HBsAg infections. We'll advise PCR test. It's a gold standard test in this one, but in viral infections like COVID also we advise reverse PCR. Okay, which is called as Australian antigen. Which is called as Australian antigen. HBsAg, hepatitis B, is called as Australian antigen. Prophylactic dose of TT. What is the prophylactic dose of TT? Is 250 units. 1 ml of TT vaccine contains 250 units. Prophylactic dose of TT is 250 units, that is 1 ml. So usually the patients will come and ask you to give TT after falling and after biting from something else. So what is the intention of giving a TT is to avoid tetanus disease. There is no treatment once tetanus is developed in the body. That's why we are giving a tetanus vaccine. TT vaccine is not going to prevent any infections. Septics. Usually, patient will come and ask you about give me septic injection. TT is not a antiseptic injection. TT is a vaccine that will going to prevent tetanus disease. Got it? So polio vaccine, you know, it is of two types. One is oral polio vaccine and one is intramuscular polio vaccine. So oral polio vaccine is a Salk, sorry, Sabine. It is a live attenuated vaccine. Oral polio vaccine is a live vaccine, but inactive. Live polio virus will be present in oral polio drops, but it is inactive state. It is called as Sabine, SABINE. This question was asked many times. So polio drops is called as Sabine, SABINE, live attenuated vaccine. Oral polio vaccine, Sabine, live attenuated vaccine. Oral polio vaccine is called as Sabine. Sabine meaning ಏನಂತಂದ್ರೆ live vaccine. So intramuscular polio vaccine or internal polio vaccine, IPV, internal polio vaccine is called as Salk vaccine. It is a killed vaccine. In the Salk, we used a killed vaccine. Salk vaccine is killed vaccine. So there is a contraindication for live vaccinations. The diseases are leukemia, pregnancy, and corticosteroids. Those who are consuming corticosteroid regularly, live vaccine should not be advised. Those who are pregnant, live vaccine should not be advised. In case of leukemia also, live vaccine should not be advised. So OPV is contraindicated in case of pregnancy. You know about ARV, anti-rabies vaccine? It's called as human deployed cell vaccine. 20 international units per kg of body weight. The dose of anti-rabies vaccine is 20 units per kg body weight. So what are the complications of mumps? You know about mumps? So very common infection. So what are the complication of mumps is arthritis, pancreatitis, encephalitis, and myocarditis. These are all the four common complications of mumps. So arthritis is testicular infection followed by testicular atrophy, arthritis, pancreatitis, encephalitis, and myocarditis. These are all the complications, four complications of mumps. So write down live vaccines. ಅವಾಗಲೇ ನಾನು ಪೋಲಿಯೋ ಒಂದು ಎಕ್ಸಾಂಪಲ್ ಕೊಟ್ಟೆ. So live vaccines are two types, live vaccines and killed vaccines. So here is the list of live vaccines. Live bacterial vaccines, first heading, live bacterial vaccines, BCG and typhoid. BCG vaccine and typhoid is live bacterial vaccine. So live viral vaccines, OPV, MMR, yellow fever. MMR is mumps, measles, and rubella. So live viral vaccines are OPV, measles, rubella, and yellow fever. Killed vaccines, killed bacterial vaccines. First heading, killed bacterial vaccines. Cholera, pertussis, tetanus, diphtheria, meningococcal, pneumococcal, influenza. These are all killed bacterial vaccines. Cholera, pertussis, tetanus, diphtheria, meningococcal, pneumococcal, and influenza. Killed bacterial vaccine. Cholera, pertussis, tetanus, diphtheria, meningococcal, pneumococcal, and influenza. Question will be direct. Tetanus is dash. Options ಅಲ್ಲಿ ನಿಮಗೆ live bacterial, live viral, killed bacterial, killed viral. There may be four options. So it is killed bacterial vaccine. Okay. So killed viral vaccines are rabies, hepatitis B, Japanese encephalitis. Killed viral vaccines are rabies, hepatitis B, okay, Japanese encephalitis, and OPV. IPV. OPV anbutala miss it's IPV. Rabies, hepatitis B, Japanese encephalitis, and IPV. Vaccine recommended at the age of 9 months is measles, mumps, and rubella. MMR kuda 9 months alle koduthivi, measles kuda 9 months alle koduthivi. Coplic spots seen in measles. So rubella vaccine dose. Rubella vaccine is a live attenuated vaccine. Dose is 0.5 ml. Route of administration is subcutaneous. Foods with most appropriate limiting amino acids are in pulses. Methionine is a very common amino acid present in the pulses. In the maize, it contains lysine and triosin. Lysine, LYSIN, lysine and triosin is the common amino acid present in the maize. Wheat contains lysine and threonine. Wheat contains lysine and threonine. Who invented typhoid vaccine? Right, 1896. Transmission of malaria, Ronald Ross. DDT discovered by Zindler. Properties of DDT by Paul Muller. Anti-rabies vaccine discovered by Pasteur, 1883. aldehyde test in Kala Azar. Aldehyde test is a test advised in case of Kala Azar. So it is invented by Napier, Napier, Napier. The eighth day disease is called as neonatal tetanus. Neonatal tetanus is called as eighth day disease. WHO slogans ಒಂದ್ಸಲ ನೋಡ್ಕೊಳ್ಳಿ. Just wait with WHO slogans. So modern ಮತ್ತೆ ಆಯುರ್ವೇದಕ್ಕೆಲ್ಲ ಒಂದು ಲೆವೆಲ್ ಮುಗಿತು. Next is yoga. We'll finish within 10 minutes. Yoga. Yoga chittarutti nirodhaka. Yoga will do chittarutti nirodha. So it will control mind. So from we will celebrate World Yoga Day on 21st June every year. From which year it was started? Any idea? 2015. So World Yoga Day will start from 2015. It will be celebrated on 21st June. This is an FAQ, frequently asking question part of current affairs. Should remember. So World Yoga Day will be celebrated on 21st June every month. So it will be started all over the world from 2015. Got it? So Yogastu Chittarutti Nirodhaka. So as you remember Ashtanga Yoga, the same thing. Out of that Yama, Niyama, Asana, Pranayama, Dhyana, Dharana, Samadhi is Ashtanga Yoga. Out of that Yama is Ahimsa, Satya, Asteya, Brahmacharya and Aparigraha. These five are called as Yama. Niyama, Shaucha, Santosha, Tapa, Swadhyaya, Ishvara, Pranita. These five are called as Niyamas. Bandhas and Bekas. Kumbhaka types, just remember Ujjaini, Shitali, Shitakari, Bastika, Brahmari, Mursha, and Plavani. So 1, 2, 3, 4, 5, 6, 7, 8. There are 8 Kumbhakas explained in yoga that you should remember. Bandha, Moola Bandha, Jalandhara Bandhan, Uddayana Bandha. 3 bandhas explained in yoga, you should remember. Okay. So without following Yama and Niyama, we should not go for asanas. So we should go with Yama and Niyama, then only we should go for asanas. So these are all the social and behavioral conducts we need to follow. One, we need to go for asanas. Okay. So pranayama and all should go through. Usually some asanas and their indications they will ask. This is an important FAQ. Try to find the notes of asanas and their indications. Antaranga yoga and Bahiranga yoga is there. Yama Niyama asana, pranayama, dhyana, up to pranayama is Antaranga yoga. Dhyana Dharana Samadhi is Antaranga yoga. Remaining 5 is Bahiranga yoga. Dhyana Dharana Samadhi is Antaranga yoga. Remaining first 5 are Bahiranga yoga. Kumbhaka Beda 2 types, Anta Kumbhaka and Bahya Kumbhaka. Pranayama sir 18 number, that's a Ujjaini Pranayama, Kumbhaka Sindhavalla. Pranayama sir 18 number, Shitali, Shitakari, Surya Vedini, Shitali, Brahmari. These are the 8 types. Shatkarmas on the Npitkolli, Navli, Dauti, Bastika, Neti, Kapalvati, and Trataka. So usually remembered in final year BMS, Kach Kissa as a syllabus. So Navli, Dauti, Basti, Neti, Kapalavasti, and Trataka. Shatkarmas, 6 karmas. Shat Chakras is the second level question. I will share you the chart. So Mooladhara, Swadhisthana, Manipura, Anahata, Vishuddha, and Adna Chakra. So just remember where is the sthana of these particular chakras. ಇನ್ನೂ ಫರ್ದರ್ ಕ್ವಶನ್ಸ್ ಅಂತ ಅಂದ್ರೆ they will ask how many petals are there in each chakra ಆ ತರ ಹೇಳ್ತಾರೆ, but it's not necessary. Just remember the chakras. Indian Red Cross Society established in India in 1920. So WHO, World Health Organization, was established in 1948, 7th April. 7th April is celebrated as World Health Day. 7th April World Health Day. June 21st is World Yoga Day. Rockefeller Foundation was established in America 1913. The founder is John D. Rockefeller. All India Institute for Hygiene and Public Health is situated in Kolkata. All India Institute for Hygiene and Public Health is situated in Kolkata. The main intention is to control VUCA. Ford Foundation is founded by Henry Ford in America. Food and Agricultural Organization, FAO. Food and Agricultural Organization, FAO. The headquarters will be there in Rome. Food and Agricultural Organization, FAO. The headquarters will be there in Rome. So it is established in 16th October 1945. World AIDS Day, 1st December. So how many hours we need to work a day according to WHO? How many hours one should work in a day? 9 hours in a day. One should have to work 9 hours in a day and 48 hours in a week. Doctor's Day ಯಾವಾಗ? 1st July. Anti-malarial month is June. Okay. So incubation time, incubation period chart on ಕಳಿಸ್ತೀನಿ. Just follow the chart. Incubation time, incubation period. Sterilization method, burning, incineration ಅದೊಂದು ಚಾರ್ಟ್ ಕಳಿಸ್ತೀನಿ. So PHC, primary healthcare center, should be there in every 30,000 population. One PHC should be present in every 30,000 population. Anganwadi should be kept for every 1,000 population. One nurse will be there for 5,000 of population. Okay. Pharmacist for 10,000 population. What about doctors? PSC ಒಬ್ಬರೇ ಡಾಕ್ಟರ್ ಇದ್ದಾರೆ 30,000 population. It's India. So vaccination, vitamins, you have to make a chart. Incubation time of communicable diseases, you have to make a chart. Eat stable and light sensitive vitamin, vitamin K and riboflavin. Vitamin K and riboflavin is called as eat stable and light sensitive vitamin. Okay. Magenta red trunk is due to the deficiency of riboflavin. Magenta red trunk is due to the deficiency of riboflavin. Raw beef tongue is due to the deficiency of niacin. Raw beef tongue is due to the deficiency of niacin. Vitamin that does not cross placenta is vitamin D. Vitamin that does not cross placenta is vitamin D. Vitamin destroyed by an ultraviolet light is vitamin B12. Okay. Vitamin that are synthesized in the gut flora is B2, B12 and vitamin K. But use ಆಗಲ್ಲಂತೆ ಗಟ್ಟಲ್ಲಿ ಉತ್ಪತ್ತಿ ಆಗಿದೆ ಅದು. In the body, vitamin produced inside the body is vitamin D. Vitamin which are only present in animal food is B12 and D. Okay, vegetarians alle B12 ಮತ್ತೆ D ಎರಡು ಸ್ವಲ್ಪ ಸಿಗೋದು ಕಷ್ಟ. Vitamin synonyms ಕೂಡ ನೋಡ್ಕೊಂಡು ಹೋಗಿ, daily requirement and as well as the source of the vitamins. Vitamins, vaccines and incubation period. So these are the three main FAQs in vrutta. Okay. So my part is I need to send the notes along with the charts. Today I will edit the notes and I will send you the charts in the group. This completes swasta vrutta.